A healthy 50-year-old adult should stay up to date with vaccines recommended by the CDC and other health authorities to prevent serious illness. Here's a list of recommended vaccines. Routine vaccines for a healthy 50-year-old. Influenza flu protects against seasonal flu, which can be severe at older ages. Annually, Tdap tetanus, diphtheria, pertussis protects against whooping cough and keeps tetanus immunity current. Once if never received, then TD booster every 10 years. Shingles Recombinant Zoster Vaccine, Shingrix prevents shingles and related complications like postherpetic neuralgia. 2 doses starting at age 50, 2 to 6 months apart. COVID-19 prevents severe illness and hospitalization. Follow CDC current booster recommendations. Pneumococcal, if risk factors present, protects against pneumonia and bloodstream infections. You might need these based on lifestyle, travel, or job exposure. Hepatitis A, B. If at risk, for example, travel, healthcare work, sexual exposure. HPV, human papillomavirus, typically for those up to age 45, but can be discussed with your doctor. MMR, measles, mumps, rubella, if born after 1957 and never vaccinated or immunity is unknown. Varicella, chickenpox, if never had chickenpox or vaccine. Should you get the shingles vaccine Shingrix if you never had chickenpox? Yes, you should still get Shingrix even if you've never had chickenpox or don't remember having it. Here's why. Key points. Almost everyone born before 1980 in the US is assumed to have been exposed to varicella zoster virus, which causes chickenpox, even without symptoms or memory of illness. And Shingrix is recommended for all adults aged 50 and older, regardless of whether they remember having chickenpox, and whether they received the older chickenpox vaccine. Shingrix protects against shingles, herpes zoster, which is caused by reactivation of the same virus that causes chickenpox. Even if you believe or were told that you never had chickenpox, you should still receive 2 doses of Shingrix, 2 to 6 months apart, starting at age 50. If you want to be absolutely certain, you can request a blood test varicella zoster IgG to check for prior exposure, but this is not required before vaccination. FDA will restrict future COVID-19 vaccines based on age risk factor. FDA officials indicated that future FDA officials outlined new restrictions for COVID-19 vaccine approvals in the United States that could limit use of the shots among healthy people. The policy shift was announced Tuesday in a New England Journal of Medicine article written by FDA Commissioner Martin McCurry, MD, MPH, and Vinay Prasad, MD, MPH, who leads the Center for Biologics Evaluation and Research and is the agency's top vaccine regulator. FDA officials outlined new restrictions for COVID-19 vaccine approvals in the United States. Image, Adobe Stock. In the article, McCurry and Prasad indicated that adults aged 65 years or older, and anyone aged 6 months to 64 years who has one of dozens of conditions that place them at a high risk for severe disease will have access to future COVID-19 vaccines, such as updated fall shots, as long as the study shows the vaccines induce an immune response, as has been standard for COVID-19 vaccines. For anyone aged 6 months to 64 years without a risk factor, however, McCurry and Prasad indicated that the FDA would require data from randomized placebo controlled trials that evaluate clinical outcomes before the agency will approve COVID-19 vaccines in this age group, a longer and more difficult pathway for approval. The shift largely aligns with the FDA's recent approval of Novavax's COVID-19 vaccine, which restricted the shot to people aged 65 years or older and adolescents or adults aged 12 to 64 with at least one risk factor for severe disease such as cancer, diabetes, HIV, being overweight or pregnant, being a current or former smoker, having a substance use disorder, or having chronic kidney, liver, or lung disease. The FDA's new COVID-19 philosophy represents a balance of regulatory flexibility and a commitment to gold standard science. The FDA will approve vaccines for high-risk persons and at the same time demand robust gold standard data on persons at low risk, McCurry and Prasad wrote. These clinical trials will inform future directions for the FDA, but more important, they will provide information that is desperately craved by healthcare providers and the American people. Most countries have already switched to risk-based recommendations for COVID-19 vaccination, rather than recommending them universally, which has been the U.S. policy. The possibility of switching to a targeted, risk-based approach to COVID-19 vaccination was discussed by CDC Vaccine. advisors last year before they ultimately recommended sticking with a universal vaccine recommendation for people aged 6 months and older. The issue is on the agenda for next month's meeting of the CDC's Advisory Committee on Immunization Practices, ACIP, but now seems moot in the context of the FDA. Is new policy, said Paul A. Offit, MD, Director of the Vaccine Education Center and attending physician in the Division of Infectious Diseases at the Children's Hospital, Philadelphia. They're kind of usurping the position of the ACP. Typically, the FDA is a regulatory agency. They say to companies, you may now distribute this vaccine, but it's the ACP that really decides who gets it, Offit said. It sounds like the FDA has made that decision for them. Offit said the new policy will prevent healthy adults who want to get vaccinated from being able to do so. Uptake for the updated COVID-19 shots in the U.S. has been low, but may have ticked up this past season. CDC data showed. A person could reasonably choose to get this vaccine who's not in a high-risk group, Offit said. And I just wonder whether that person, if they make that choice and get that vaccine, if the insurance company would still pay for it, or whether the insurance company would only pay for those vaccines that are given to those in high-risk groups. He also wondered if the policy of requiring placebo-controlled trials is ethical, given that SARS-CoV-2 continues to circulate and cause hospitalizations and deaths in the U.S. While people who are 50 to 64 are at low risk, they're not at no risk, he said. I mean, no one's at no risk. Anyone could be affected by this virus. I don't think knowing there's a vaccine that works and that's available, that you can knowingly give placebo to people. I don't think that an institutional review board should find that ethical. Peter J. Hotez, MD, PhD, said the article by McCary and Prasad heavily emphasizes the acute consequences of COVID-19, including symptomatic infection, case fatality, and hospitalization rates, but does not address the chronic sequelae, including long COVID and thromboembolic events such as heart attacks and strokes. The reason that's significant is because vaccines have been shown to prevent long COVID and heart disease, and there are the consequences of long COVID and heart illness in younger age groups who could be denied access to vaccines, Hotez Dean of the National School of Tropic Medicine at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development in Houston, told Helio. The American Academy of Pediatrics also expressed concern that the new policy ignores long COVID and would take the choice away from families who wish to protect their children from COVID-19, especially among families already facing barriers to care. Just as we are seeing with the current measles outbreak, lower vaccination uptake means more disease. Sean O'Leary, MD, MPH, Professor of Pediatrics at the University of Colorado School of Medicine and chair of the AAP's Committee on Infectious Diseases, told Helio, when everyone has access to immunizations, our communities and our children are healthier, said Offit. Obviously, every child needs a vaccine who's not been naturally infected or vaccinated. What's next? The FDA's own vaccine advisors are scheduled to meet to discuss the formula for the 2025 to 2026 COVID-19 vaccines. The subject of the new policy is sure to come up.